This is Dr. Jerry Hesch at the Hesch Institute. I'm a physical therapist, and I see clients in Aurora, Colorado, and we also teach workshops on treating joints throughout the body. And Lynn has had 3 surgeries to the right knee, and as a result of that, has reduced flexion in this knee by about, measuring the heel to the buttocks when she's on her stomach, is about 10 inches, whereas on the left side she has full flexion. Heel is about 2 inches from her buttock. And the patella is somewhat rigid, going side to side. And if I try and move it inferiorly, there's no give. And if I try and move it superiorly, there's very little yield. If I squeeze it, I'm not able to get the patella to move anteriorly or towards the ceiling. On the left knee, there's rather good patellar mobility. And if I try and squeeze this beneath it, I don't get any forward mobility. If I try and move it inferiorly, yes, there's give. And then if I try and move this patella superiorly, there's a little bit of yield. And after 3 surgeries, she certainly does have, side-to-side differences. You can see some of that scar, and you can see some soft tissue swelling here. Okay. If you would just quickly describe your 3 knee surgeries, and then I'll demonstrate the lack of movement, okay? In the femur. So your first knee surgery was what, please?
First knee surgery was cleaning up under the patella and patellar tendonitis, arthroscopic surgery, and had platelet-rich plasma injection into the patella tendon. And after that surgery, my quad had shut down. I had no quad. I could not do a quad set. I couldn't put any weight on the leg without the knee just giving out. And a year later, I had a surgery where they had to clean up all the scar tissue and free up the patella tendon, which had contracted and bound down completely, and the patella was completely bound down with scar tissue. And that was cleaning up just about 2.5 hours of cleaning up scar tissue. And then a couple years after that, I had just a little more scar tissue cleaned up, just a minor surgery, just cleaning up a little more scar tissue where things had bound down.
And how is it doing now? I know that your quads are real inhibited. Today you test strong in your quads and your hamstring, at least per manual muscle testing. How's the knee doing?
I mean, my strength isn't where it needs to be yet. It's certainly weaker than the other leg, but yes, I am gradually increasing, building up strength. It's still, my hips have been limiting my ability to strengthen my knee at this point.
And are you aware of stiffness in the knee?
Yes.
Okay. So what I find is that if I load the tibia, I can then induce some passive force through it. That was predictable based on that would move in that manner based on the fact that you have normative give in external rotation and normative give in internal rotation of tibia on femur. Coming to the femur and giving at least 30 seconds of load at approximately 20 pounds of force, I don't feel like I'm taking up the slack anywhere, and now I'm going to add another 20 pounds in a brief impulse, and it doesn't move through that structure. Very, very rigid. On this femur, you can see that when I push, you can see movement is taken up throughout the leg, upper and lower leg, and then when I impart an additional amount of force, you can see that it translates through it. So we have a very stiff femur in terms of posterior glide on the right, and I can hyperextend that knee perhaps 5 degrees by lifting up the lower leg. And on the other side, it seems like you have a greater degree of hyperextension. Do you agree with that?
Yes.
Okay. I think it's pretty easy to see that. And so it appears that this femur is stuck in posterior glide. And I name it that because there's no movement there, and by appearance, This certainly looks posterior. Because the tibia has normative posterior spring and it has play anteriorly in neutral, then we name it for the femur because it's stuck. So it appears to be stuck in the end range of posterior glide of femur on tibia. And I'm going to treat this for 5 minutes and then we'll come back and film it. And this is the second case that I have this week, and I don't see a lot of clients. I treated my neighbor and just posted that just this morning on YouTube. And it's a pattern I'm seeing more and more of, but I'm not finding much in the literature addressing that accessory motion of posterior glide of femur on tibia. And I think it's an area ripe for research because there are some dramatic responses to 5 minutes of treatment. So we'll stop filming here and we'll treat it and then we'll come back.